Hi, dear friends. This side Dr. Sonu Panwar, your microbiology infectious disease faculty, and here I am with the high yield MCQs for the NEET PG 2024. Along with that, they are equally good for FMG exam also. So you can definitely have a last revision like over these particular stuffs because out of them, some high yield facts are there which ought to be asked in the exam. Okay. So without wasting time, let's start up. I'll be bit fast to cover up the things. So, but like we'll be telling a very important high yield stuffs to you. Now, talking about this particular question first, a 50-year-old male patient underwent surgery for peritonitis. After some days of surgery, the patient started developing wound around that particular area. Wound infections, I think, wants to tell. Okay. The gram staining of the wound sample shows numerous pus cells, and those are gram positive cocci. Okay, on culture it shows black colored colonies, black colored colonies. The caustier organism also requires the synergistic activity of penicillin and aminoglycoside. So up till now you must have guessed it. The answer for this particular organism is yes, please. The answer is this, guys. Enterococcus faecalis. What is the answer? Enterococcus faecalis. And we are talking about this Enterococcus, which are like sort of a controversial fellows. And they are the normal there in our gut. And these normal commensals of our gut sometimes turns problematic for us and thereby leads to these particular infections of the wounds and all, surgical wound infections. And thereby in them it can cause the pus and all. Okay. So obviously the answer is what? Enterococcus faecalis here. Besides that, regarding Enterococcus faecalis or the other organism which is there, the faecium, one important thing which I like to tell you, they are some sort of a notorious bacteria which able to sustain up that 40% bile. They could able to like handle up that thing also. 6.5% NaCl. So all these like they are heat resistant to 45, 65 temperature also. So means they are not normal ones. So Enterococcus faecalis and faecium. This is what is the answer here. And important question is that to this combination they have started having the resistance, and that's why second line we use that is vancomycin. Second line drug is vancomycin. So this question comes that this penicillin aminoglycoside combination, when does it work? When it doesn't work, what is the reason? What have made them this like resistant to this particular stuff? And later on, the drug of choice which you use for them is Venco, and even to this also what they have become? VRE. Okay, what they have become? VRE, vancomycin resistant enterococcus. And how they have become that? Because of a particular gene, that is VAN gene. And what does it have done? D-alanine changes up to what? D-alanine D-lactate or D-alanine D-serine. Okay, D-alanine D-lactate or D-alanine D-serine, or this particular change is there in the cell wall pattern. That's why they have become VRE. And for that, what you use? Linezolid and daptomycin. Okay. Bacteroid physalis. The only question which comes regarding this is also a normal commensal of us. And the only question which comes regarding it is this, that this one have a mild potent endotoxin. What it have? It have a mild potent endotoxin. And this particular mild potent endotoxin may leads to shock and DIC. This is what is the important statement, may leads to shock and DIC. And this is an example of obligate anaerobe. Okay, this is example of what? This is an example of an obligate anaerobe. Which one? Bacteroid physalis, and it's a gram negative bacillus. That also you know. Okay. Now coming to the picture, this is that picture of bile acetylene agar on which it produces black colored colonies, and when you do the gram staining of it, it produces what? Spectacle like appearance, and they are violet color because this is gram staining. Is it fine, guys? Now coming to the second one. A young boy presented with a high grade fever, rash, abdominal pain, pea soup diarrhea, which is a transport media used to culture a bow organism. Means used to carry this particular organism, which particular transport media you need to have. So there is a high grade fever, there is a rash, there is abdominal pain, and pea soup diarrhea. That is observed in typhoid fever. Okay, which type of fever is there? Step ladder pattern. Which type of spots are seen? Rose spots. Okay, now what is the incubation period of typhoid? Around 7 to 14 days, 1 to 2 weeks. And in this, you find a particular sign also positive termed as what? Faggot sign. And what is Faggot sign? Relative bradycardia. Okay, relative bradycardia is termed as Faggot sign, seen in this and brucellosis. They are the two important examples of the disease in which it happens. That is the relative bradycardia. Now they are asking here the transport media for this. The transport media for Shigella and Salmonella is same, and that is Sachs buffered glycerol saline. Sachs buffered glycerol saline, and for this the enrichment media is selenite F broth, and the best selective media is Wilson and Blair. Along with that, you can use DCA and XLD. Is it fine? Talking about selenite F broth, this is for Salmonella Shigella only, but this is an enrichment media, liquid media. Alkaline peptone water, it is for Vibrio cholerae. Wilson and Blair, it's the best selective media for Salmonella typhi. So it should not be the answer. The question asked is regarding the transport media. What is the property of transport media? Those which maintains the viability but does not allow the multiplication. That is what is termed as transport media. VR, you must be remembering of Carey Blair, okay, spikes for pyogenes. So all this needs to be, and this is the important one which is asked, Sachs buffered glycerol saline, mainly for Shigella, but can be used for Salmonella also. Okay. Now, this is the transport media, buffered glycerol saline. Now coming to the third one. The pus sample was collected from a burn patient. Isolated organisms found to be facultative aerobe and is well cultured in a high salt concentration agar. Found to be catalase positive also. The probable causative agent is. So, in this question, I like to tell you this thing that don't jump upon. Means when you see the burn patient, don't jump upon to your answer that this is Pseudomonas. You have to see up what is given. High salt concentration agar. And high salt concentration agar is used for which organism? Mannitol salt agar. Mannitol salt agar is for what? Staph aureus. So answer here is what, guys? Staph aureus, and that is also what, guys? Catalase positive. So this is important to know. And if I want to change up to the Pseudomonas, I will write citramide agar, disinfectant agar, catalase, oxidase, both positive. Here it is catalase positive, oxidase negative. So like this, the examiner will rotate you in the exam, and this time the timeline is also there. So try to be like try to be cautious that what that particular individual wants to ask. Okay. So answer here is Staph aureus rather than this. And in fact, I should tell you the most common cause in burn wound also is Staph aureus itself. Surgical wound infection, Staph aureus. Okay. Pseudomonas is also there. And it's commonly found also in burn wounds, and favorite is that of that. But overall data, if you see, Staph aureus is the most common cause of surgical wound as well as burn wound infections also. Okay. Now, after this is catalase, and coagulase test also they can give up. That will be more hint. But in this, it's all about the culture media, high salt content agar. Okay. Now, the fourth one, the one group of medico friends had Chinese fried rice, and where they had Gautam Nagar. Okay. Next day, most of them start vomiting and diarrhea. The most probable organism associated with this clinical condition is, this everybody knows, the answer is Bacillus cereus emetic strain. Bacillus cereus emetic strain, incubation period how much? 1 to 6 hours. Resembles what? Staph aureus, food poisoning. Another one is diarrheal, 8 to 16 hours. Important is, this one is having a heat stable enterotoxin. This particular one is having what? A heat stable enterotoxin, and this heat stable enterotoxin is having what? Increased in cyclic GMP, guanosine monophosphate. Okay, guanosine monophosphate. To remember this particular aspect also. Besides the diarrheal one, that is the heat labile, increase in cyclic AMP. That is in that particular one. Is it fine, guys? So remember this particular aspect also. Now, other than that, there is a table in which the Harrison table, in which all the incubation period along with the incubation period, all the organisms are being given off. And what is that? Simple ones we'll see. The 1 to 6 hours, 2 names, Staph and Bacillus cereus. 8 to 16, 2 names, Clostridium perfringens, that is the that gas gangrene one, and Bacillus cereus, diarrheal one. More than 16 hours, there are number of them, like Vibrio cholerae, enterotoxigenic E. coli, traveler's diarrhea, okay, enterohemorrhagic E. coli, bloody diarrhea, O157H7, was remembering up. Salmonella also does inflammatory diarrhea. Campylobacter jejuni, Shigella, SSC. Okay, Vibrio parahemolyticus, that is also a sort of a bloody diarrhea. Okay, Vibrio parahemolyticus, a sort of a dysentery. Now, important is what important elements is being eaten up and that relates with that particular organism. So if somebody talks about ham, pig stuff, okay, mayonnaise, pastries was asked, Staph aureus. Okay, if somebody talks about fried rice, Bacillus cereus. If somebody talks about beef, okay, beef, poultry, bird products, legumes, gravies, talk about Clostridium perfringens. Okay, Bacillus cereus, diarrheal one it is. So meat, vegetables, cereals, not much of the things contaminated. Meat stuff means both of them they have meat. Clostridium perfringens and Bacillus cereus. Vibrio cholerae, shellfish contamination or obviously contaminated water. Toxigenic one, salads, cheese, meats, water means all sorts of things, contaminated water or milk and meat products. That is toxigenic one. Traveler's diarrhea, watery diarrhea. Enterohemorrhagic one, beef. Okay, again roasted beef, salami, raw milk, vegetables, apple juice. Apple juice is red, so red. Enterohemorrhagic one, obviously contaminated one. That leads to this enterohemorrhagic E. coli stuff. Salmonella. Regarding the salmonella, again the same. Salmonella, these are which one? NST, non-salmonella typhi, associates with beef, poultry, eggs, and all that. Okay. Jejuni, same. Poultry, raw milk. Shigella, potato, egg salad. Shigella infections from egg salad. And same was there in the staph also. Okay. Lettuce, raw vegetables. So very, very cautious while dealing with raw vegetables. Can get the infection of Shigella. Vibrio parahemolyticus, mollusks, crustaceans, those particular ones. That is this particular one, that is, what do you say? Vibrio parahemolyticus, if you remember of eating up what? Like 7% halophilic, if I told you, eating up these mollusks and crustaceans. That is crab, oysters, contaminated crabs and oysters. So Vibrio parahemolyticus. And which phenomena, guys? Kanagawa phenomena. On which agar? Vagatsuma agar. Okay, and I've already told you, सात समुद्र पार गए, okay, and then eaten up this particular mollusk or crustaceans, that is crabs and oysters, contaminated one, landed with what? Seafood poisoning, and thereby what happens? Then got like what you say, recovered from that, and that's why you sung a song, Gana gaya, Kana gawa, kaha gaya, Wagha border pe, to Vagatsuma agar. Okay, so remember like this, at least in the exam, something you will able to approach upon. Okay, this particular, now coming to the fifth one, as you can see, these beautiful chicks are being slapped, and this is parvovirus stuff. Okay, and parvovirus is what? It's a single stranded DNA virus. Okay, it's a single stranded DNA virus, and it is non-enveloped. None of the options gives that answer. Okay, so basically this might be the answer if I make it non-enveloped. So single stranded DNA, non-enveloped is the answer. How I get to that? I know that every DNA virus is double stranded except the parvo, and non-enveloped DNA viruses are which one? We get it by the example of PAP. Okay, what is there in the PAP? Parvo, adeno, and papova. Parvo, adeno, and papova. And what comes in papova, guys? Human papilloma virus, that comes in papova. And parvo is single stranded DNA. The answer here it is, if we make like that, single stranded DNA, non-enveloped. And this also mnemonic is helpful in the exam, that is apne. And what is that? Apne? Apne ho gaye paraye jab thappad pad gaya. Okay, so what is A? A is aplastic crisis. A is what? Aplastic crisis. P is what? Polyarthralgia. And the other question which is being asked is pure red cell aplasia. Pure red cell aplasia. Okay. N is NIHF, non-immune hydros fetalis. E is erythema infecciosa. That is what is termed as fifth disease. Okay. Because पांच उंगलियां छप गई. So that particular one is erythema infectiosum. Remember, this is non-immune. In recent exams, it was just written hydros fetalis. It is immune and non-immune both. So non-immune it is. So they should be mentioning this. The hydros fetalis Which one? Non-immune. So that also needs to be remembered. Aplastic crisis along with all this. So अपने हो गए पराए जब क्या पड़ गया? थप्पड़. Okay, slapped. Somebody have slapped and अपने हो गए क्या? पराए. Okay. Now coming to this one. The organism need to be identified in the picture given, and that is the picture. So guys, this is the band forms. This is the band forms of Plasmodium, and these band forms of the Plasmodium malariae. Okay, and Plasmodium malariae, what is the mnemonic for us? In the Plasmodium malariae, the mnemonic is zoom in. What is the mnemonic? Zoom in. And in the zoom in, Z is what? Siemens dot. Z is what? Siemens dot. And old age RBCs, old age RBCs. M is maximum incubation period. N is associated with nephrotic syndrome. Associates with what, guys? Nephrotic syndrome. Okay. And how to remember that there is a girl, Mala, whose age is how much? 28 days, because incubation period is how much? 28. And she is how much old? 20 days, 8 days old, Mala. And this particular girl, Mala, unfortunately have which particular disease? Nephrotic syndrome. Okay, so like that you can remember of some of the facts regarding the malaria. And this particular one here in this picture, you are seeing a what? A banana shaped gametocyte. And banana shaped gametocyte is seen in Plasmodium falciparum, the one which complicates the maximum falciparum. Okay, and in this what you have, guys, the mnemonic umber. And what is the umber? Umber is A is ecol forms, and all age RBCs are involved. All age RBCs, there is no discrimination, old and new. All age RBCs are involved in this. That's why the infection is massive. Besides that, M is Morris dot. M is what? Morris dot. B is what? Banana shaped gametocyte. B is what? Banana shaped gametocyte. And R is what? R is recrudescence. Okay, means because of the incomplete treatment, the recrudescence happens. Other than that, renal failure. Other than that, renal failure or recrudescence associates with this Plasmodium falciparum. Is it fine? So this is also to be remembered. And in the case of Vivaxin, ovale, the young RBCs and the size of the RBC increase. And banana shaped gametocyte is a feature of this particular one. Is it fine? And which particular stage is not seen in the blood smear of this? Answer is Sison stage or Sison stage. Is it fine? Now coming to the next one, seventh. A sputum specimen of a 70-year-old male cultured on 5% blood agar. The culture shows the presence of alpha hemolytic colonies with central depression with elevated rim next day. So basically this is Karen coin appearance. The Karen coin appearance is in pneumococcus. Here that you know. So gram-positive cocaine short chains, catalase negative, bile resistant, bio positive or resistant? Positive. Gram-positive cocaine pairs, that is diplococci, catalase negative, bile soluble. Answer is second. It is pneumococcus. And in this, what I need to know here, that the disease caused by this is COMS. And what is the COMS? COMS is conjunctivitis. Okay, COMS is conjunctivitis, otitis media. M is meningitis. Okay, P is pneumonia, and S is sinusitis. S is what? Sinusitis. Now, as you know that this is the most common cause of all sorts of pneumonia, that is community acquired pneumonia, lobar pneumonia, and that's why we say that in the HIV positive also the most common cause of pneumonia is pneumococcus only. But when the CD4 count falls below 200, that is pneumocystis jirovecii, and most common cause of atypical pneumonia is mycoplasma pneumonia. Whereas in the meningitis, mostly in all age groups, this is the most common cause except the neonatal, in which GBS is there. Okay. Besides that, in this, what you need to know that it is bio positive. And what is bio? Bio is bile soluble, inulin fermentation, and optochin sensitivity is positive in the case of pneumococcus. And the same thing is negative in whom? Viridans. Means they are bile insoluble, they are inulin non-fermenter, they are optochin resistant. Optochin is a drug that you know. Okay. So like this also the question might come. Now talking about this 8th question, a 3-week-old child presented to the pediatrician with meningitis. A presumptive diagnosis is being made of a late onset perinatal meningitis, the CSF culture was positive for gram-positive bacilli, which the following characteristic of this bacteria would be helpful in differentiating from other bacterial agents. So, guys, in the question itself is talking about the gram-positive bacilli. So, if it is a gram-positive bacilli, then which likely organism we can talk about in the bacilli which does meningitis or that sort? The answer is Listeria. And Listeria shows a unique property of motility at 25 degrees Celsius. That is termed as which motility? Differential motility based on temperature. The differential motility based on temperature means at 25 it is motile and at 37 it is non-motile. And the similar thing is also being shown by whom? Yersinia enterocolitica and Yersinia pseudo-TB. Okay, Yersinia pseudo-TB and Yersinia enterocolitica, these are also there, which shows differential motility based on temperature, but they do not cause meningitis. Okay, but they do not cause what? Meningitis. So this also needs to be remembered. But if instead of gram-positive bacilli, it is written as cocci, then what, guys? Gram-positive cocci, then there might be a fight between GBS and the Listeria because sometimes it looks like a cocci only. Then the best test is to go for catalase because this is negative in the case of GBS, that is Streptococcus eclexia, that is these are catalase negative. Listeria is catalase positive. Okay, Listeria is catalase positive. So that means if they want to confuse you with GBS and Listeria, then catalase is the reaction. But here it is very clear they are talking about bacilli. So motility is a unique feature of Listeria. And you know the drug of choice is ampicillin and it grows at 4 degree. It can cause in pregnancy what? Chorioamnionitis, leads to abortion in premature births. Besides that, it can also lead to, in the newborns, a granulomatosis infantiseptica. That particular disease also was asked. Now coming to this, a nurse stated that she had mononucleosis-like syndrome as a teenager, concern for an unborn child, which neurological sequelae can happen by this particular CMV stuff. So basically, they have given up in the down only that they are talking about cytomegalovirus. First of all, you should know what is the number HHV5. The CM we choose for how much years? 5 years. So CMV is HHV5. Epstein-Barr virus is HHV4. HHV4, that is Epstein-Barr, which affects up the B cells because CD21 CR2 is there over them. And this particular cytomegalovirus HHV5, this one does mental retardation and deafness. And which is the most common feature? The most common feature is hepatosplenomegaly. The most common feature is what? Hepatosplenomegaly. Besides that, investigation of choice for this is the antigen demonstration by any sort of ELISA. Besides that, sample of choice is urine. Besides this, CMV retinitis, which is there in HIV positive, that is also very common, a CD4 count of less than 50. And in the post-kidney and post-bone marrow transplant, it does what? CMV pneumonia. That is also an important question regarding the cytomegalovirus. Okay. And those particular owl appearances, what actually? Intranuclear intracytoplasmic inclusion bodies. And they look like an owl eye appearance. Okay, that is what is a typical owl eye appearance. With this only the question have come. And what is this owl eye appearance in infected cells? This is intranuclear intracytoplasmic inclusion body, basophilic ones. Okay, now coming to the 10th one. A 5-year-old child with diabetic ketoacidosis, ptosis of right eyelid, periorbital swelling, black necrotic skin lesion under his eye. The biopsy of the skin lesion shows non-separate hyphae with wide-angle branching. So guys, after this diabetic ketoacidosis, black necrotic skin lesions, what should we think of? We should think of mucormycosis. And mucormycosis was wrongly said as black fungus. Which is the black fungus? Phyllophora and Cladosporium. For that, which particular stain you use? Masson trichome stain. And that particular one mostly related to chromoblastomycosis. And here it is mucormycosis. And mucormycosis, this is a characteristic picture of it. Why does this black necrotic mass happens to be angiothrombotic activity of it, angiothrombosis it does, and this is the cotton woolly colonies of mucor. And if it is the rhizopus, which a mucormycetes member, that will be having a what? Rice, that is salt and pepper like appearance. And what is the drug of choice for this condition? Lamp. And whenever you see DK, DM, all this iron, excess iron overload conditions, in them, this particular infection is common. And this is also termed as belonging to mucormycetes, zygomycetes, and phycomycetes also. And what they have a wild angled hyphae, aseptate. And the septations are seen in aspergillus. S is aspergillus. Dichotomous branching. Dichotomous branching, mostly the angle is acute, that is 45 or 60. Okay. So answer to this particular question is obviously what? Mucormycosis. And regarding those black fungus stuff, Phyllophora and Cladosporium, Masson trichome stain is used. That was asked. Now, talking about this, a thick curdy white discharge, KOH poncho, Shuda hyphae, we are talking about Candida, that is Candida albicans. Candida albicans shows up this phenomena termed as Renault broad phenomena, germ tube formation. Along with that, the chlamydospore formation in the corn meal agar. There's a nutrient deficient media in which this particular chlamydospore is produced. Fine. Besides that, there is a species termed as Candida krusei, which is intrinsically resistant to azoles, and that's why what you need to use for them, lamp. Otherwise, drug of choice of Canada is fluconazole, that you also know. And this, I think you everybody knows and should know. Beta 1,3 glucan assay is done for CAP. And what is there in the CAP? Invasive candidiasis, invasive aspergillosis, and pneumocystis xerovasi. Remember, this is not crypto. This is invasive candidiasis. It is invasive aspergillosis, and this is pneumocystis xerovasi, which does pneumocystis xerovasi pneumonia and HIV positive at the CD4 count of how much? Less than 200. And what is the drug of choice for this pneumocystis xerovasi? Cotrimoxazole. Cotrimoxazole. Is it fine? Then, the reinfection which of the following virus can lead to more severe disease with complication, that is antibody dependent enhancement. That is a feature of dengue. And regarding dengue, number of questions coming regarding the lab diagnosis of it. The lab diagnosis of this particular one is revolving on NS1 antigen testing, and the IgM antibody which is there in this comes on the 5th day. Besides that, you can go for the culture also in the cell culture lines, and you can go for the RT-PCR, which is investigation of choice. DHF, if we talk about, that is having a tonic A test in which more than 10 pedicle lesions per square inch. Along with that, there is a high grade fever. Along with that, you have hemoconcentration increase in hematocrit for the dengue. Regarding the other flaviviruses, if we talk about, the other flaviviruses are JE. In the JE, that is termed as Japanese encephalitis. And what is it in Japanese encephalitis? The pigs. The pigs are the reservoirs. The pigs are the amplifiers here, sorry. And reservoirs are what? Egrets, herons. And what is the transmitter? The Culex mosquito. Besides that, we have in this KFD, that is termed as monkey fever. The monkeys are the amplifiers, and rats and squirrels, these are the reservoirs, and the transmitter is a tick, that is monkey fever. Besides that, in this particular one only we have yellow fever. Yellow fever is not there in India. The vaccine is 17D, and now it is lifetime valid, the certificate. And this 17D vaccine can be given to a pregnant female. And which bodies are seen in this? Torres bodies, which are intranuclear inclusion bodies in the yellow fever stuff. So that also is important. Regarding the rabies, Rhabdoviridae family, Lisa Vinny stuff, two types. One is the aggressive one, that is the furious stuff, and another paralytic one. Paralytic one, they have a, what do you say? They have edema, muscle edema, whereas aggressiveness is seen in that furious stuff. And other one is there, that is termed as dump rabies, that is by the vaccine induced stuff. Now, in the antemortem diagnosis, you go for what? That is nape of neck, hair follicle, and colonial smear. You can go for RT-PCR, you can go for direct fluorescent antigen testing, that is antigen demonstration using the antibodies. And postmortem depends on the Negri bodies by Steller's technique. And which two particular places in India are there where the rabies is not there? Lakshadweep and Andaman Nicobar Island. Measles. Measles incubation period how much? 10 days. Triple C, cough, coryza, conjunctivitis. Rash 4 days before, 5 days after, 2 days before, 5 days after, and chicken pox. That is also there. Besides that, warm infiltratory giant cells are seen in this. That is also intranuclear intercytoplasmic inclusion bodies. And what are the complications? SSPE. What is SSPE? Which happens after 10 to 15 years. And what is in SSPE? You have those burst wave pattern. You have those particular CSF having antibodies against the measles. This particular one. And what is the vaccine used here? Vaccine strain administered on jackal. Regarding mumps, bilateral parotitis followed by orchitis and oophorytis in the young males or females, and they can happen in the child also. And what is the atypical one? Meningoencephalitis. That can also happen, precedes the parotitis in this particular one. And what is the vaccine strain for mumps? That is the Zarelin. That is the Zarelin. Now coming to this one, a 11-year-old boy attending a summer camp and develops what? Throat, headache, fatigue, conjunctivitis. And this particular one is a medical staff examination found to be a slight fever of this particular one. Next one to do is other campus also develop this. So basically, it's a sort of what? Outbreak in that particular campus. So basically, this is epidemic keratoconjunctivitis done by which virus? Adenovirus. Which virus in that also? That is the 8-1937. These are the ones which leads to the epidemic keratoconjunctivitis. And obviously, if we want to find out the adenovirus as per this, non-enveloped it is, double-stranded with fibers at its vertices, the answer is A. But you should know what is there in the options others. Non-enveloped, double-stranded, circular DNA virus. This particular one is what? This particular one is polyoma or you can say HPV, human papillomavirus, along with the polyoma. They are circular DNA. What about the enveloped single-stranded negative sense? That is observed in orthomyxo family, that is of the influenza, and in the paramyxo one, that is all those are there, na? Parainfluenza, mumps, measles, all that. So that is in the paramyxo. They both have negative sense. They are single-stranded and they are enveloped. Enveloped double-stranded linear, then this particular one is herpes, guys. Linear is there in the herpes. So these types, they can also give the disease and they can ask up in this fashion. So this question is important. You can remember with them with this particular stuff. Is it fine? Now, match the following eggs. This particular one is having these hooklets and this is observed in tinea. So this is tinea egg and tinea solium, tinea saginata, both look like same. Which is longer? Tinea saginata solium. Saginata is longer, which is armed. Tinea solium, which is the larval forms, which is cellulose. Okay, how does infection of neurocysticercosis happens? By eating up the eggs with the contaminated food and water, and by eating up the pork also, which is having the cysticercus cellulose. Now this is H. nana, having the polar filaments and polar thickening. Okay, this particular one is roundworm and this particular one is hookworm. Okay, this particular one is what? Hookworm. Hookworm is having what? 4 to 5 blastomeres, and this one is Ascaris, that is having a unfertilized egg, and this is having a proper fertilized egg. Which one? That is the Ascaris, roundworm. Is it fine? And which one is bile stained? Obviously, which looks yellow, that is the bile stain, and all others are non-bile stained. Besides this, the important one is this also, which is having a dumbbell shape, having the mucus plugs. Another one is a D shape, that is this one planoconvex with a tadpole-like larvae. That is seen in Entropes vermicularis. And this particular one is seen in Trichuris trichiura. This is seen in what? Trichuris trichiura. So these are the possible questions regarding the eggs which can come. Whereas in the case of viviparous stuff, viviparous is tissue nematodes. Tissue nematodes are what? Wuchereria bancrofti, Onchocerca, volvulus, okay, lova. These all are what? Viviparous stuff. Now coming to the last one, the attachment and effacement pathogenesis. Attachment A/E lesions. A/E lesions, they are observed in pediatric age group, EPEC. This particular one leads to this attaching and effacing lesions, attaching to the enterocytes and damaging them, effacing them. That is EPEC. Then you have this particular EIEC, which resembles shigellosis and secrete a Shiga toxin, bloody diarrhea. EAEC leads to persistent type of diarrhea. More than 14 days, the diarrhea is going on. Besides this, it is done by a particular toxin, East 1. Besides that, it also leads to traveler's diarrhea. EHEC, Shiga-like toxin, virotoxins, virocytotoxin 1 and 2, which is an exotoxin secreted by this, and it leads to HUS in the children. Besides that, hemorrhagic colitis in the adults, and which is the culture media, SMAC, sorbitol, meconic agar, and another one is what? The another one is which particular media? That is the rainbow agar. Okay, so SMAC is why we use SMAC. So guys, we use SMAC. Why? Because sorbitol non-fermenting is EHEC. Sorbitol non-fermenting is EHEC. And the children, what they try to make the voice E in the childhood. Na? So that's why remember A/E lesions are seen in EPEC. And remember the same thing can happen in the EHEC also. A/E lesions, they can be seen in EHEC also. Enterohemorrhagic E. coli. And which enterohemorrhagic E. coli serotype? O157H7. O157H7. What is O? Somatic. H is flagellar. Okay, H is flagellar. Now see this particular one. That in the case of EPEC, see this particular one also, that they produce a cup-like pedestal structure. Okay, and there is a formation of a dense plaque of actin and other cytoskeleton filaments beneath the adherent bacteria. So if somebody asks you that cup-like pedestal structure is seen in which particular infection, the answer is EPEC. Okay, so if you revise up these particular ones well, most of the things of yours will be done. And obviously, along with that, you must see, as per me, before going in the exam, the images which are there on my YouTube channel. You will go to the playlist. There you can find all those images. In 2 hours, you can revise up all your microbiology with the help of those images. Along with this, you will able to get most of the questions in your exam. So very best of luck from my side for this NEET PG 2024. I hope you will all pass with flying colors and achieve very good ranks. And do message me up which sort of questions they came in the exam on the day of the exam itself. Okay, so thank you so much. Take care. Bye bye.